Welcome to Botox Cowboys. I'm going to be the host today as Tyler is off getting engaged, and she actually did say yes. So congratulations to Tyler. I'm here with, yeah, I can't believe someone actually tied the knot with that guy. We are here with Dr. Robert Dale, who is also known as Handsome Rob for anyone in the industry. Dr. Dale is not only a good friend of mine, but an exceptionally good cosmetic injector. I will let him introduce himself formally, but he is the medical director at the Vanity Lab, the owner of Evergreen Medical Spa in White Rock, BC, and a recent finalist at the AMWC Aesthetic Awards in Monaco for top non-surgical facial rejuvenation. So welcome, Rob. I really appreciate you being here. Why don't you tell us a little bit about yourself so our audience knows who they're learning from today?
Thanks, Andrew. Yeah, and thank you for inviting me to be on the podcast with you. I've been listening to it on my commute, and it's awesome. I found a little shout out you put in about Scrotox in one of the earlier episodes. Yeah. My name is Rob, Dr. Robert Dale from Vancouver. I have a clinic with my wife, Dr. Supreet Maan, out in White Rock, BC, like you mentioned. I work in Yaletown at a clinic called the Vanity Lab, and I've been doing this work maybe full time for about 6 years now. And it's really been a blessing and a passion finding this industry. And maybe we'll talk about it later, but you were my foray. You were the person that taught me at the very beginning. So I have you to thank for a lot of this. So yeah, I'm excited to chat with you more today.
Well, I appreciate that. So we're going to cover a few different topics today. We've got some pearls for patients who are listening. We've got some tips for injectors. But first and foremost, let's just talk about this briefly. What drew your attention to aesthetics in the first place? You were working, a little bit about your background is you started your career in urology, a surgical discipline, and then you decided to transition out of that, completed your CCFP designation, and then what took you from there into aesthetics?
Yeah, that's a great question. And it's funny, sometimes when I'm chatting with patients, this comes up and I tell them this story. Like you mentioned, I started off my training in surgery in urology. So I've always loved working with my hands, and I love the technical aspects of medicine. I always wanted to be some kind of, what we call a proceduralist. So I was doing surgery for 2 years, and I loved the surgery part. And then I found that there was other things I never considered, like the job prospects after, being on call all the time, basically a lot of the lifestyle factors. And I decided, okay, for those reasons, it's not for me. So fast forward, I entered the workplace. I was doing cardiac surgery, assisting, working in the hospital. I was really sort of missing that kind of hands-on artistic sort of approach. So I decided to try Botox, and I took your course. And I remember this is back at the Park Casino, I think, a number of years ago. And I found that it was so much different than I thought it was going to be, in a good way. And I was really enamored by it, especially with filler. I found filler really interesting. And basically once I started it, it was a one-way path. I slowly started paring down my hospital work. Eventually I gave it up completely. I focused completely on aesthetics. And for me, what aesthetics provides is this opportunity for us to use our hands to deliver a technical procedure, but also to connect with patients in this sort of lighthearted, fun environment, and to use our artistic eye a little bit. Because in medicine, it's all objective. There's so much objectiveness, and it's all algorithm based, so there's not really a lot of room to flex your creative muscles in medicine. But this is like a really unique area where you can. So yeah, no looking back.
Yeah, absolutely. Well, you've progressed, really well in your career and quite quickly, largely due to what I suspect is, your good technical skills. You have a good bedside manner. You're passionate about this. You're always pursuing more and more education, and you're just curious and want to learn. And I think that's pretty important. What other skills, do you feel just for injectors translate well to success in the field of aesthetics? I mean, we were both athletes. We both had high acuity medical training, what are a couple of ingredients that you see in people in the industry who have been successful?
Yeah, the athletics one is interesting. And you're right, we both share sort of a sports background. You with your track, I did sailing. I think that what, sports teaches a lot of lessons for life, but this concept of practice, honing your skills, learning from your past performances, trying to look at things with a critical eye and always trying to be better. I think that's something that sports teaches you really well, and it's applicable to so many things, but our field included.
I do think that aesthetics is a little different than hospital medicine in that there's just going to be unlimited number of patients. You sort of just show up and do your job, where what's required to be successful in aesthetics is a tremendous amount of energy, hard work, creativity, a commitment to a cause, and an unwavering, like you cannot compromise to get to that final dream or endpoint. And that level of determination, I do think, comes from, sports in many ways for people in the industry who have done sports or who have had some background where they have to have a long-term commitment. They're going to face challenges, setbacks along the way. Because it's not necessarily for the faint of heart, because for people who just want to come in and coast, this is not the field for you.
Especially nowadays, there's so much competition.
Absolutely. It's a great industry to get into. I obviously see thousands of people come into it, and there are some tendencies where you know pretty early on that, this might not work out for you. I also see that people with a high acuity background, whether it be, say, ER nursing, ICU nursing, or surgical backgrounds, ER, many different fields where people have had to learn a comprehensive skill set, deal with challenges. These typically translate well to the field of aesthetics.
Absolutely. Yeah, totally agree.
Okay, now I want you to myth bust for me.
Sure.
This is one that we hear all the time. I know you feel strongly about it, and I share your opinion. I hear all the time, isn't hyaluronic acid filler bad?
Yeah, great question. Very loaded question these days if you're cruising on social media. I would say in general, for all of these treatments, hyaluronic acid included, they're neither good or bad. They just are. And what I mean by that is they're just tools. And it's what you do or don't do with these tools that make them good or bad. So it's like saying, I don't know, filler is like a tube of paint, right? And you give that tube of paint to different people and ask them to paint a picture of a mountain. You're going to get a lot of different outcomes. And if a painting is good or bad, it's not the paint's fault. It's the person holding the paintbrush. And so I think people attribute goodness or badness to the products, or they'll vilify a certain product. But at the end of the day, it's not the product's fault. It's what's being done with it.
Yeah, that was going to be my follow-up question to this. In fact, so I'm going to redirect you back to this thing because patients are going to ask. Yeah, no, it's good. It's good. There's going to be a few ones. So people over the last year, I think largely influenced by social media and people that look overdone in public come in and they just have this very firm stance. They'll say, oh, I'll get a Botox treatment, or, oh, I'll get a biostimulant treatment, but I don't want HA filler. It's unnatural.
Yeah. So what I tell them is hyaluronic acid, first of all, it's a component in your own body. So we have it walking around in our body all the time. The difference with these gels is that the companies will modify them, like they'll add cross-linking, or they'll modify them in the lab so that they don't break down so quickly. But at its heart, hyaluronic acid is native to our own body. It's been around for decades, and there's hundreds, maybe thousands of studies on it, and it's safe in the body. Are there complications and risks with it? Yeah, for sure. Every single procedure on the face of the planet has complications and risks. You have risks walking across the crosswalk to get to your clinic from your parking spot. There's always risk, but the risks are low if it's done properly. And like I said, it's not the filler that's bad. It's a safe material. There's certain things that we can talk about more. Like people say, oh, it migrates, or oh, it lasts longer than they say it did. And I have some specific answers to those questions. But in general, the products are safe and they're well studied.
Oh yeah, there's a tremendous amount of evidence to support their utility and safety in the industry. I think that some of the narrative that's online is, oh, look, they don't stay where they're put. And you'll see a picture of an MRI where there's some filler throughout the face. And those things make me so frustrated. I saw one from a plastic surgeon in France the other day, and she was saying, don't ever get fillers. She was plugging for plastic surgery, which I thought was pretty hilarious. And the picture that she was showing, there's just so much you don't know about it. There's so many different types of fillers. For instance, there are very soft fillers that effectively hydrate the tissue of the skin. And so with a treatment like that, you would want to spread this around generously, right? And so people don't know what they're looking at. And filler as a volumizing agent is absolutely necessary as part of an injector's toolkit to provide lift, to provide for that volume loss that occurs over time. And so, no, filler is an amazing thing, but it all depends on your injector. And so that kind of takes me to my second point, Rob, which is, what do you say when someone comes in and they're just like, oh, I'll never use Restylane filler again, or I hated that result with Botox. I don't want that, or whatever product it is.
Oh, first I have a comment on the MRI thing, because I was at a dinner a couple months ago and we were talking about this, about MRIs, and it was with this well-known doctor from Australia, and it was interesting because an MRI doesn't see hyaluronic acid. Like when you see this picture, these dramatic pictures, and it looks like there's filler, like if you look at the physics of it, MRIs see water. And so it's like, what is this picture actually showing? Like, is that the filler? Is it water that's being absorbed by the filler? Like, it's not so clear. So that's one interesting comment. And the second thing is, there was a news story in Australia that kind of was one of the first published stories of this MRI of the filler face. And this backstory behind it was an aesthetics reporter in Australia who had the study done, and they had just told her that it was like out of, for interest's sake. She was really happy with all of her treatments. Like there was nothing wrong with her face, and she was really happy with the outcome. But then they took this MRI and they put it in the newspaper and they said, oh, look at all the filler that's in her face. And it made it sound like this bad thing. But she wasn't unhappy. Like it looked good. And so anyways, and you gotta be careful, like what you're seeing out there.
Yeah, there's a tremendous amount of misinformation. And so when I have somebody come in and, speak strongly on a product, I always, give them the chance to tell me more. But the reality in our industry is that if you have a poor cosmetic result, it is likely not due to the product. It's either the injector didn't set expectations correctly, they chose the wrong type of filler, they put it in the wrong tissue plane, or they did not set the patient's expectations appropriately. And so it's really, I'd say, an indictment on injectors, because injectors, a lot of them would not be interested in taking responsibility for a poor outcome. And, says, oh, no problem. Next time we won't use this brand of filler. I don't totally love it. And they'll go to a different product rather than take the accountability that, hey, this outcome is exclusively on your shoulders.
Well, yeah, 100% agree. Yeah, to your original point, if someone comes in, they don't want a product, or if they say the product doesn't work for them, try and dig more deeply into that. And usually it's a provider issue. I mean, even between toxins, people say one toxin doesn't work or one works better than the other. And it's because a lot of providers don't know, like you have to inject the toxins differently. They all have their own personalities. And if you don't understand that, you'll get different results with different products unintentionally.
Absolutely. A mark of a good injector is being able to use any product. And, when you consider your top 3 neurotoxins, you got Xeomin, Botox, Dysport, some people will come in and they'll just say, one of them doesn't work for me. Well, they all work exceptionally well. The molecule in the vial is indistinguishable. It's literally identical across the 3 products. But there are going to be subtle differences in toxin load, how far it spreads. And you just, as an injector, have to be aware of that, adjust your markings and dosings appropriately, and you'll achieve an exceptional result with all 3.
100%. Yeah.
Okay, talk to me when a patient comes in and they say, Dr. Dale, I just want the lowest dose of Botox. Just give me baby Botox.
Well, first we have an appointment minimum now. So that helps. No, but I tell them that, okay, a couple of things. So in terms of, how would you get that low dose? You can either take away areas or treat areas in isolation, or you can just do like a really low dose. Both are not good, I don't think. In terms of only patchwork treating the face, our faces are designed to move and express as a whole unit, and the muscles, they don't work in isolation, they work together. And so what actually looks more unnatural is that you start spot treating things. If you treat things together, it looks more natural, which is counterintuitive because everyone always thinks, oh, do less, it'll be more natural. Well, it's actually do more, it'll look more natural. So I try to explain that, like, we're trying to treat the face as a whole because that's the reality. Like, that's how people see you and that's how you live. And in terms of the dosing, I mean, I think it's becoming more apparent in the public, but there's tons of data to back this up, that the dosing of these treatments with neuromodulator directly correlate to how long they last. And we want these, if you're going to make the investment and you're going to put yourself through this procedure, in my opinion, like, I want the treatment to last you. So I don't really believe in underdosing. And there's also this theory now, people are more and more worried about, developing resistance or antibodies to the toxin. So if you're getting baby dose and you're doing it every 4 or 5 weeks, you're increasing your exposure to the antigen. In theory, you might be able to induce resistance earlier, or you're more likely to do that. So I don't think that's a good way of doing the treatments.
No, and I think this term baby Botox is
a marketing ploy or something.
100%. It's just a total joke. So this is a medication, and as with any medication, you need to dose to effect. You've heard me say this hundreds of times at my programs, dose to effect. And I think that there's a real great inconsistency in education and training. And I think that a large percentage of injectors across the country, learn a standard dose. Doesn't matter, young, old, male, female, strong, weak, and they just stick to that. And it's their narrative because it sounds nice to be like, oh, let's just sprinkle this in. Well, guess what? Treatments aren't going to last. They look ridiculous. People waste more money over time. And at the end of the day, I'm going to use the lowest possible dose to achieve a nice cosmetic effect that gives you the best value and longevity for your treatment. And I can tell people that is the most effective way to do it. So don't buy into that baby Botox nonsense. It's just marketing. All right, last myth buster. This one I chuckle at. Use Sculptra for bone.
Oh man, yeah. So that one, I've never really understood it. For those that don't know, Sculptra is one of the biostimulatory treatments. It's an injection, stimulates your body to build collagen, elastin, regenerate tissue. Amazing treatment. When I was first taught Sculptra through the pharmaceutical company, and now I consult for the pharmaceutical company to teach other doctors. It was taught, like, you can inject it with the needle down on the bone. You can inject it with a cannula on the subcutaneous plane. You can do everything with it. It never made sense to me, because if the goal of it is to build collagen and improve the skin quality, why would you be injecting it with the needle down on the periosteum? And yes, they said, oh, there's some data that there's communication between the periosteum and the skin surface, but it just doesn't make any sense. Like, why would you put the product there? So I've always been a firm believer that, all of these products, biostimulator, filler, toxin, whatever, they all have their optimum sort of use case, and no one, just like so many things in life, like, no one product can do absolutely everything, no matter what the drug companies tell you. So I try and use the products for what their strengths are. And Sculptra, in my opinion, its strength is skin quality, collagen, elasticity, some of this new stuff about pigment suppression, but it's all skin quality stuff. I don't buy it. Even though there's still some people out there, some really famous KOLs, that's like their big technique. So
no, my point on that is that, and I tell this to everyone that I work with, is question everything you hear in aesthetics. It doesn't matter who's talking on a, big podium. There is some absolute nonsense in the field of aesthetics. Just like patients, when they are reviewing social media, there is some absolute nonsense out there. And people who have developed big names, not necessarily for their aesthetic skills, but perhaps their charisma and their entertainment value on stage. And yeah, sculpture is not a bone product, in my opinion. Now, I've got an interesting face. So you and myself are similar in that we believe in full face consultation, right? Just not a spot treatment. Ultimately, focusing on one area can make certain areas look more aged and you can, lack balance. I sent you a picture of our fellow Botox cowboy, Tyler Brooker. Pictures of Tyler are available on our website for anyone who wants to look at him and assess him. And as I've mentioned, we can't fix ugly, but what we can do is we can help him. And he needs it to get ready for this wedding. So just run us through what a typical Dr. Dale consultation would look like as you were to counsel our buddy Brooksy here, if he were to walk into Evergreen Clinic with you as the physician.
Yeah. Well, we have a pretty in-depth consultation process, actually. It's about an hour long, but Cole's Notes versions are, we want to learn about the person. So, why is he seeking these treatments? And he might say something like, oh, I don't like this wrinkle between my brows. And a lot of people would stop there and say, okay, well, let's put Botox there. But my question to him would be well, why don't you like that wrinkle between your brows? What does it mean to you? Why are you interested in treating it now? What's changed? And then it comes out, oh, I'm getting married and, 3 months from now, and I want to look good in my photos. And when I'm at work, sometimes people think I'm angry when I'm not. And there's always a deeper reason why people want these treatments. Always. It's never just about a wrinkle. And so my job and my consultant's job is to uncover those reasons. And I think that underpins a lot of our success in the clinic is our ability to do that. But anyways, we ask him some very in-depth questions about what he's looking for, but more importantly, why he's looking for those changes.
I can answer those things.
Yeah, you can answer those. Sure, yeah.
I can answer those things. He'd like to look as handsome as his older brother, and as distinguished. So next question, how much filler does he need and where? We're just going to do the Cole's Notes, Cole's Notes version of Tyler Brooker. So give him a volume assessment right now.
This is the video you sent me, right? We're looking at this picture.
Yeah.
Honestly, from a filler perspective, I don't think he really needs a lot, in my opinion. I think he's got a nice masculine face. He's got a really square jaw. I can't see his full profile because he's 45 degree, but from what I can see, his chin is nice and projected. He's got defined cheekbones. Maybe his nasolabial folds can be lifted back a little bit and softened, but overall, I don't think he needs a ton of filler. At least from this picture. And I'm a big filler guy.
Oh no, Tyler's going to run with this thinking that he's too pretty for filler. So what I really notice is his lips. I think that we could both do a nice job of some lip augmentation here that would be quite natural. What are your thoughts?
Interesting. Yeah. I've done a few male lips. Don't do a ton of it. Just hasn't really been a big part of my practice, but I see what you're saying for sure.
Yeah, I agree with you on the nasolabial folds.
Is smiling, he loses his upper lip a bit when he smiles. So he might be a good candidate for a lip flip if he's not fully into lip filler.
Doctor recommended lip flip for Brooksy. And yeah, I think overall, he has good bone structure in his face. So typically when we're assessing a face, we're working top to bottom, lateral to medial. And, in terms of his actual side profile, the number one area that he needs filler is frontal bone has receded. And so Tyler would benefit from a couple of syringes. We're actually going to do that here shortly for him. That's an area that males need treated quite frequently. I think his cheeks look good. I would say that I think perhaps a little bit of half a syringe per cheek would look quite natural and sharpen it to match it up with his jawline. And then nasolabial folds and lips. And again, like you said, it's not like he needs a lot of filler, but even in someone that doesn't need a lot of filler, there are still really nice areas where we can help people look refreshed.
Totally. If you look at it's mirrored, but his left side, in our view, his right side, his face is asymmetric and he's got a flatter cheek on his left. And I don't recommend like everyone start doing this, all the injectors out there, but I do asymmetrically treat people now. If I'm trying to soften asymmetry, and for him, I think we could make, his left side match up the right a bit more, and that would be a filler thing.
Yeah. Yeah. And, with this wedding coming up, I think what I'd recommend is he probably looks better with his hair shaved off to look like me. And we need to get him to grow his facial hair out a little bit more. Now, what would you give as your advice, Rob, for injectors who want to succeed? Like someone comes to you and says, okay, Dr. Dale, look what you've done in 5 years. You've gone through it. You've had lots of success. Give me 3 pearls, quick hitters that you would recommend to people who want to be successful in aesthetics.
I'd say number 1 is get the right training and start your journey, start your path on the right trajectory. And that's one thing that I feel really fortunate, having taken the course with you and learning with you those years ago. You did a great job, teaching everything in like a very evidence-based, like no BS kind of way. And with a good sort of moral compass and a good framework of thinking about the industry. And that was super valuable. It wasn't just about, put the Botox here, here, and here. It was like how to think about the industry in general. So that would be super important for anyone entering the industry.
Thank you. I'm honored.
No, I tell people that all the time when people ask me for recommendations, and that was my experience. So I'm totally happy to. Number 2 would be you need to do it for the right reasons. So I think a lot of people think of this as like it's an easy money thing, or I don't need to do night shifts in the hospital thing. You need to do it because you're genuinely interested in the patients and you genuinely want them to get the best outcomes, and you care, because people will sense that in you when you're talking to them, and it will impact the kind of treatments you're able to deliver. So doing it for the right reasons. And this is not just some like a gig to make a quick buck. I don't think you'd be successful doing that these days. And the last pearl would be have an open mind, I guess. Like you mentioned, everyone's there telling you all these things. All the drug companies have their agenda that they're trying to push on you. So always thinking critically about it, and willing to consider other options and other theories and other ways of doing things, and try it out for yourself. And don't just take other people's word for it.
Yeah, I think those are 3 great tips. What's something that gets Dr. Rob Dale really fired up, like grinds your gears in aesthetics?
Oh, grinds. Yeah, let's say excited or grinds. Like, okay, grinds my gears.
Yeah.
Oh man.
Something gets under Rob's skin. I know you're a pretty calm guy, but as an injector, what's something that bugs you in the industry?
Okay, I guess one of them would be, and unfortunately, this doesn't happen too often anymore, just by the way we do our screening and stuff. But when some patients, they want like a really good deal, or they want to bargain me down on the price, or they'll say like, oh, so and so will do it for this, or with anything that will kind of like cheapen the service. Because in my opinion, like you should be coming to a provider because you trust them and you want to see them for their expertise and the results that they can deliver, not for the price, whether that's high or low. And if people are doing that, I feel like they're not appreciating the effort and the value that I'm trying to bring to them, and they're kind of cheapening it down to some number. So that I find frustrating.
Okay,
I also don't like big lips.
Yeah, fair enough. You hear that? Anyone in the Vancouver area, kick off your consult with Dr. Dale asking for 35% off, and it will go very smoothly for you.
Yeah.
Now, you got any questions you want to put me on the spot with, Rob?
Well, you're obviously involved heavily and have really shaped the training industry in Canada. Where and you got a finger on the pulse. Where do you see the industry going in the next 5 years, 10 years even? But let's say 5 years is probably easier.
Yeah, let me shake this magic 8 ball. The evolution in the field of aesthetics will be more towards anti-aging, regenerative medicine, and even more comprehensive care that goes beyond simply volume replacement or muscle relaxation, wrinkle improvement, texture repair. And people will start thinking a little bit more about how they can combine their cosmetic needs with their health goals. And I think there is some interesting and exciting new technology that is coming out in the anti-aging space beyond injectables that I think will be synergistic with this in terms of just straight up injectables. These are obviously wonderful tools if used by the right person who take the time to get to know you and meet your needs and exceed your expectations. There will always be a place for this. I see that the industry has become a bit watered down, as I mentioned, sort of commoditized. And we've seen this, and I want to be really clear, it's not me complaining about people charging less money than me. My target is patients who are seeking the highest level of results. I've really worked hard over my career to be able to offer those confidently. And so I'm not going to be the right physician, just like you, I'm not going to be the right physician for every patient out there. But when you see people with no training, no certification offering these products at cost, it creates confusion in the market. There's a race to the bottom in price because a lot of people fear that somebody is charging less than them. Amongst the patient community, it's really challenging to filter out what's real information and what's not. And many cosmetic clinics have keyed in on that. So I see there being some confusion, but over the next 5 years, I expect it to expand into more full body health wellness rather than point treatments. I think that's the way I would see this going. What are your thoughts?
Yeah, no, I basically echo, what you said. I think a lot about the commodification part of it, and so many clinics and so many providers, and what does that mean? And I remember talking to someone at dinner, and they're one of the OG aesthetic doctors in Vancouver, and he was like, "Oh, you guys, all you young kids, your Instagram." And when I started my clinic, I didn't even have a website, and I was thinking, yeah, like that's fine. But if you were to start today and you didn't have Instagram and you didn't have a website, like, do you think that you could build your practice? Like, no, it's a different market now. It's going to be a different market in 5 years. Like, it evolves. And I think, like, you look at any other industry that is more commodified, like a t-shirt, you can buy a t-shirt for $1. You can buy a t-shirt for $200. They're still both t-shirts, right? But there's a separation of value, perceived value, brand experience. There's other things that quality that like go into it. And so I think that there'll be more of a spread, I guess, in our industry. And doesn't mean that there's no room for high end. It just means you need to be very thoughtful about how you craft your experience, results, brand, emotions that you elicit in the patient. You have to be a lot more sophisticated with that.
Yeah, I find the conversation interesting because obviously mentorship is key. And I try and mentor a lot of people across the country, and I have mentors myself. One of the challenges is when you talk to somebody who, was an industry OG 30 years ago, their perception of what worked can in many ways be obsolete now and antiquated. And you do need to be more sophisticated and thoughtful. And I've had this talk with multiple people. What worked 30 years ago, there is no chance that it would work now. So how do we evolve? How do we learn what's necessary? And I think that, pairing yourself with somebody who's got experience, but is also on the cutting edge, that's a good person to look to for help.
Yeah.
Now, tell me, what was the highlight of 2025 for you, and what are you looking forward to in 2026?
Oh, highlights. Well, from a work standpoint, it was a really exciting year for us. We like you mentioned, we were the top 3 finalists at the AMWC Monaco conference, which was like a really big honor. And then I work a lot with one of the pharmaceutical companies, and their big international KOL who pioneered like a certain type of filler treatment. And they did a big competition this year with over 500 injectors, and we won it. So we were in the 10 finalists around the world, the only person from North America. So that means next year you're talking about mentorship. So I get directly mentored with him for 2026. That was a huge win for us. So it's been really exciting from a work standpoint. And then I think, 2025, I think was not an easy year for a lot of people in this industry. And for us, we actually grew. And I think that was, it was a huge win. I think it was a testament to kind of the differentiation of experience that we've been working on for the past couple of years. And we're starting to see the fruits of that. So it's been a great year, honestly. 2026, we're looking at expanding our offerings in both our clinics and really focusing on sort of business development. And it's something I've been learning a lot about this past year, kind of more of the business side. So I'm really excited to kind of dive into that and it's learned a whole other skill set, as you know, operating multiple businesses.
Oh, amazing. Any plans for kid number 3?
Oh God, no. I say that, but I haven't undergone any procedures to secure that fate. But no, we definitely no plans for kid number 3.
Listen, Uncle Andrew's here to help if that third comes along. I need a break from work and taking a day off here and there, so I'm happy to step in and play babysitter.
Oh man, that's not taking a day off. It's a different kind of work. Fun work, but different kind of work.
Exactly. Well, I appreciate your time, Rob, joining us. And again, for anyone looking to get treated by Dr. Deo, whether it's in Yaletown, you can find him at the Vanity Lab, or in White Rock at Evergreen MD. I've watched Rob's progression over the years. I worked with him, done many, many sessions with him. And what you'll find is an injector who legitimately does care, who is thoughtful in his approach and can deliver exceptionally good results. And so, I have referred many clients to Dr. Dale, who does things the right way. So proud to have you as a colleague. And I did remember from day one in your basic training, I was like, oh, this guy's got some juice to him. And then through your filler training and all the other stuff we did together, it's been an honor being part of your aesthetics journey.
Yeah, thank you so much, Andrew. And thanks for inviting me to chat today. And like I said, thank you deep down for setting me on the right path at the beginning too with the course. So I really appreciate everything you've done for me and for the industry in general. So, and you've been a great friend. So.
Yes, we've had some good laughs along the way, and it's a joy now that you teach with us. So this is really great. Well, give my best to the family, and we'll look forward to connecting again soon.
Thanks, Andrew.